Good afternoon and welcome to today's Downing Street press conference. I'm joined today by Sir Peter Hendy, who's Chair of Network Rail. Peter was also Commissioner of Transport for London Olympics and is the person that I asked to help with the restart of our transport network. Let me start by updating you on the latest information from the government's COBRA data file. And can I turn to the first slide, please? The slides show data on the use of different types of transport. These graphs show significant falls in the use of public transport, rail, buses, the tube in London, and even before the lockdown was introduced on the 23rd of March. This is welcome. It shows the public's responded positively to our requests to avoid public transport wherever possible. The use of motor vehicles fell substantially initially and has since risen steadily, though not back to the levels seen mid-March. Again, this is what we would expect as we have introduced some easements to the lockdown and encouraged people to return to work. One form of transport which has seen a significant increase is cycling. It's great to see so many people switching to clean, green mode of transport with significant public health benefits. It's very encouraging to see. Next slide, please. The number of tests carried out or posted out in the UK has risen past the 5 million mark for the first time. That's 5,005,565. This includes a record 220,057 tests carried out or posted out yesterday, a new high total. 281,661 people have tested positive. That's an increase of 1,805 cases since yesterday. The graph shows a steadily falling number of identified cases on a 7-day rolling average, despite that increase in testing. Third slide, please. This slide shows the latest data from hospitals. 505 people were admitted to hospital with coronavirus in England on the 2nd of June, up marginally from the 475 a week ago, but down from the peak of 3,121 on the 2nd of April. 604 coronavirus patients are in mechanical ventilation beds in the UK, down from 783 a week ago, and down from a peak of 3,301 on the 12th of April. Fourth slide, please. This slide shows what's happening in hospitals across the country. There are now 7,312 people in hospital with coronavirus in the UK, down 15% from 8,558 a week ago, and down from a peak of 20,699 on the 12th of April. As the graph shows, while there is some variation, most nations and regions in the UK are broadly following a similar pattern. And last slide, please. This slide shows the daily figures for those who have sadly lost their lives after testing positive for coronavirus. Across all settings, the total number of deaths now stands at 39,904. That's an increase of 176 fatalities since yesterday, and that's the lowest working weekday level of fatalities. When measured by a 7-day rolling average, the daily number of deaths currently stands at 241, down from a peak of 943 on the 14th of April. These figures are a reminder that COVID-19 still represents a very real threat, that the fight still goes on to defeat it, and that there are tragically still too many people across the country who are losing loved ones. Our thoughts are with them all. As we made clear in recent weeks, our road to recovery must be carefully and cautiously managed. Most importantly, we must avoid a second infection spike. This careful, deliberate approach has been central to the restart of public transport. In advance of previous easing of the lockdown, we've ensured transport availability was increased to allow for adequate social distancing. In addition, we've also announced measures to help people choose other forms of transport. For example, with a record £2 billion invested in cycling and walking, as well as the acceleration of e-scooter trials brought forward to the end of this month. Meticulous planning, alongside the considerable effort of passengers avoiding public transport, has worked well so far. There's been an absence of crowding, even as passenger numbers have ticked up, partly thanks to the work that Sir Peter Hendy has been doing. But these challenges are about to increase. We expect, conditions permitting, that the next easing of the restrictions will occur on Monday, the 15th of June. Non-essential shops will reopen, and some children will return to secondary school. That means there'll be more pressure on our public transport. To help meet that demand, we're ramping up services on buses, trams and trains with substantial government funding. But we still need to do more. So today, I want to highlight the measures that will help take to keep us safe and reduce the risk of coronavirus, particularly on public transport. There are 3 points I'd like to highlight. First, let me reiterate, and this is really important. If you can work from home, you should continue to do so. If you cannot work from home, you should avoid transport wherever possible. And if you must use public transport, you should follow guidance, including avoiding the rush hour itself. Second, I can announce that as of Monday, the 15th of June, face coverings will become mandatory on public transport. That doesn't mean surgical masks, which we must keep for clinical settings. It means the kind of face covering you can easily make at home. There'll be exemptions to these rules for very young children, for disabled people, and those with breathing difficulties. But broadly, as we come through this phase, we're doing what many other countries have asked transport users to do. And as passenger numbers increase, and we expect this trend to continue, we need to ensure every precaution is taken on buses, trains, aircraft, and on ferries. With more people using transport, the evidence suggests that wearing face coverings offers some, albeit limited, protection against the spread of the virus. A face covering helps protect our fellow passengers. It's something that we can each do to help each other. And whilst it also remains true that measures like maintaining social distancing, washing your hands remain the most critical things to do, we also know on public transport, keeping 2 meters apart is not always possible at all times. Indeed, the guidance explicitly recognises this fact. So when more people return to the network from the 15th of June onwards, they will be required to wear face coverings on transport network. We'll make these rule changes under the National Rail Conditions of Travel and the Public Service Vehicle Regulations for buses. This will mean that you can be refused travel if you don't comply, and you could be fined. Alongside transport operators, this will be enforced by the British Transport Police if necessary, but I expect the vast majority of people won't need to be forced into this because wearing a face covering helps protect others, and most people simply want to help defeat this disease. Of course, frontline staff, those in contact with passengers, doing such an important job at this crucial time, will also need to wear face coverings. And in the coming days, the government will work with the unions who've been supportive, for which I'm very grateful, transport operators and the police to ensure that they have the supplies they need to be safe and to provide reassurance to the public. These measures apply in England, but we're working with the devolved administrations ahead of implementation. Third, to ease pressure on public transport, I want to update you on the measures we're taking to boost alternative ways to travel. Now that vehicle showrooms are opening again, there's a growing range of electric cars, mopeds, motorbikes on sale. And as our economy gets moving, their popularity will continue to increase. Later this month, we'll be introducing the Fix Your Bike voucher worth 50 quid. We'll have hundreds of thousands of more roadworthy bikes on the road as a result of this programme. And then there's the Cycle to Work scheme, which enables employees to buy a tax-free bike, an effective saving at 25 to 39%. And that scheme has been extended to cover e-bikes as well. meaning that cyclists can cover longer distances by getting assistance on those uphill stretches. And this is a great time to start using them as we redesign our landscape to cope with millions more cyclists and pedestrians in the months ahead. The evidence is that commuters are already responding. Despite fewer people travelling over the past few weeks during this crisis, we've actually seen around 100% increase in weekday cycling. And at weekends, that increase has been up to 200% compared to the pre-COVID-19 levels. We want to use this recovery to permanently change the way we travel with huge levels of investment. We're bringing forward green transport improvements that otherwise would have taken years or decades to achieve. And in the short term, whilst there's still a threat from the virus, they'll help keep millions of people avoiding public transport journeys. And in the longer term, they'll help transform our country into a lower carbon, cleaner and greener place to live. Our history shows us how quickly we can adapt as a nation. Just as we did 200 years ago when Britain invented the railway, and just as we did in the 20th century when we embraced the motor car, and then in the 1950s when we launched the first passenger jet airliner, coincidentally designed and built in my Hatfield constituency. Each of these transport revolutions was triggered by a unique alignment of people and events, brilliant engineers and entrepreneurs, cutting-edge new technologies, supported governments and the needs of citizens, combining to bring about change. And now we stand on the verge of a new transport revolution, this time not limited to one particular means of travel, but rather to all forms of transport. A green transport revolution, which will help us rebuild a stronger, more prosperous Britain, as well as a cleaner and healthier one too. I'd like to now turn to questions, and we're going to start with questions from the public. Alex from Canterbury. Alex.
How are renters going to be protected during coronavirus once the ban on evictions runs out?
Alex, thanks very much indeed. It's been clearly for people in lots of different situations, but I think particularly people renting a very, very uncertain period of time. And there's been extraordinary measures being put in place to try to sort of balance the relationship between renters and, of course, landlords. It is important, actually, that we help people get back to work. We had record low unemployment before this crisis started. We try to protect those jobs. Alex and everybody else, we want to help you to get back into those into your jobs and therefore have the money available to pay your rent. And that will be, of course, the primary thing. But of course, some of the schemes, including the furlough scheme, have quite some way to run, although the terms will change slightly. They run right through to later in the autumn, so there's some time to come as yet. Thank you very much, Alex, for your question. I'm going to turn to Charlotte from Coventry, and her question is how many travel companies are acting unlawfully by not providing refunds to customers following the cancellation of holidays within reasonable timescales. What's the government doing to ensure that people can get their money back? Well, look, the first thing to say is it is absolutely the case that holiday companies can offer you either a voucher or they can offer the money back. Ultimately, they have to offer the money back if that is what you prefer. Sometimes the holiday companies will say, we'll give you a voucher, perhaps extra time to use it, or even give you a greater value, 125% of your value or something. So you have the choice there about what to do. But ultimately, it is the responsibility of those travel companies, Charlotte, to pay your money back. So you have all the redress that exists through various different schemes, and things like trading standards would be one. It's very important that travel companies do treat their customers properly, and I'll be doing everything I can to encourage them to make sure they pay back or offer a voucher if that's what the individual consumer wants. But we can't have a situation where they're just hanging on to money, and I will be very happy to continue to follow up on that. Can we turn now to Tom Burridge of the BBC? Tom.
Secretary of State, thank you very much. On your policy to make face coverings mandatory in England in 2 weeks' time, are you expecting rail workers to police it? And are you prepared to fine people if they don't cover their face? And on your controversial travel quarantine, British Airways this afternoon is refusing to take part in a roundtable discussion with your cabinet colleagues. Is that a sign that your government is losing the confidence of UK aviation?
Thanks very much. Well, look, on the first part of this question, I'm going to ask Peter to answer it in just a second. What we're saying essentially is it will be a condition of travel. You need to be wearing a face covering, not a face mask, a face covering, to use all forms of different public transport in this country from the 15th of June. And we've worked quite closely with, for example, the unions who we've been talking to them about this. That's obviously their railway workers that you're referring to. Look, I think it's in everybody's interest to make this work. It protects everybody when this happens. As it so happens, and one of the reasons I asked Sir Peter here today, is he's had a very similar experience of introducing new rules on railways. And Peter, it's probably worth me handing over to you.
Thank you, Grant. So I was the Commissioner of Transport when we introduced the ban on alcohol on London's transport in 2008. And we were asked the same question then. The question was, would the staff be required to enforce it? What would the police do? And in the event, those questions didn't need to be answered. We are expecting the staff to wear face coverings themselves. That's obviously sensible, and the trade unions have very much supported that. But this is about people being sensible. People who use public transport are profoundly sensible. They do what they're asked as long as what they're asked is sensible. And we're just saying, please wear them because it's good for you and it's good for protecting others. I'm not expecting a huge upsurge in railway staff having to police this. I'm expecting sensible passengers to do their duty and look after themselves and others.
Thanks very much. Thanks very much, Peter. Tom, I should also add, we're working very actively to try to make sure that there's plenty of support for passengers, and people will turn up and possibly have forgotten and that sort of thing. So there'll be plenty of publicity about this in advance. There'll be notices all over stations and other transit areas. We have the British Transport Police, Network Rail, Transport for London. They will be helpfully reminding people. We deployed, as numbers started to come up, Peter deployed an extra 3,500 people, or 3,500 in total, to remind passengers. And we're going to introduce also volunteer journey makers, who are literally volunteers, who are also going to assist in reminding people about the need to wear a face covering when you travel on public transport. But I think that overall we fully expect that we're taking the powers to do it, changing the rules to do it. We fully expect most people will want to do it because we all want to defeat this disease. You asked me a secondary question. It was about aviation and the quarantine. Look, I think most people just recognise that having worked as hard as we have, and I announced in those statistics that I was providing at the beginning today, the welcome news that the number of deaths has fallen to the record low since this started lift up of, I think it was 176 today. No one wants to go back. No one wants to return to the world we were in. And following on from the scientific advice, right at the beginning, the scientists were clear. I asked the Chief Medical Officer exactly this question, and he was clear that there's not much point doing the things on the borders that we're now doing with quarantine now, because once it's already here, it's here. And indeed, countries that did it, Northern Italy, America, didn't see a reduction in cases. But as we come out of this, we absolutely must keep the numbers down, because we do not want, either people coming from abroad or even Brits going abroad and coming back and bringing this nightmare back. So it's a very sensible, very proportionate measure. And as the Prime Minister, myself, the Home Secretary have all said, we're also looking at air bridges and travel corridors in order to see how that can be amended going forward. But it comes in on the 8th, first of all.
Secretary of State, just to be clear, is it possible that people will be fined if they do not cover their face on public transport?
Yes, so on public transport, to be clear, it's a condition of travel. So you cannot travel unless you're wearing the face covering, and we'll have people there to remind you. There'll be posters there to remind you. It will be quite a visual thing that Peter is working on. There will also be other powers, so ultimately it could lead to fines. I very much hope we won't be in that situation because, as I said before, Although, of course, we'll take the powers to do this. Why wouldn't people want to do the right thing? We're all desperate to be able to get rid of coronavirus and move on with our lives. So it's in everyone's advantage to do that. And I think Peter's experience with TfL indicated that was the case as well.
Absolutely. I don't now recall how many fines and offences. It was a matter of great controversy when the alcohol ban was introduced, but actually it went in without any real difficulty at all. And I think I'm expecting my colleagues in the railway and the public transport industry, you should be seeing at every station entrance, at every station in Britain, a sign very shortly saying wear a face covering with a graphic about face covering. And we know that passengers are sensible and they'll do the sensible thing both for themselves and others.
Thank you very much indeed. Thank you to you, Tom. We'll move now to Harry Horton, ITV Yorkshire. Hi, Harry.
Thank you, Secretary of State. We've been speaking to the Bangladeshi community in Bradford today, and they've told us that they feel they're being told that they're most at risk from dying from coronavirus, but they aren't being given any suggestions about how they can stay safe. We've known for some time now that BAME communities are more at risk of dying from coronavirus. What specific advice does the government have to BAME communities to try and protect themselves from dying? And if there is no specific advice, why not?
Yeah. Well, as you are no doubt aware, PHC have been looking into this, and I think it's Professor Fenton produced the report at the end of the month. And that report's only been out a couple of days, but actually my colleague, who's a Qualities Minister, Kemi Badenoch, has already taken up the mantle with this, and will be turning that report, which looked at what the facts were, and turning it into actual recommendations. So the first thing was find out what was happening, and if the data support it, and then turn it into action. And I can actually tell you at this moment, Harry, the full terms of reference for that piece of work have just literally been published. So I suspect out of that we'll get a very comprehensive list of things that people should look at, and more that government will be doing as well. And look, I just want to emphasise, I mean, the fact that anyone dies from this is appalling, and the fact that we discover that BAME communities are potentially more at risk, as well as other categories, including men. Obesity seems to be a big factor. All of these things are a huge concern, and we will get to the bottom of it and have very practical recommendations. In the short term, though, I think it's true to say, really strict social distancing, maintaining the 2 metres, washing hands and going back to that very first basic message is so important. And lastly, as we come to these stages of unlock, being very aware or alert, as we say, of your surroundings, so you don't put yourself into positions of danger. I think all of those things would be absolutely key. Can I turn to Phil Hornby from ITV Meriden? Hi, Phil.
Good afternoon. How is Alok Sharma? Doesn't what's happened to him prove the folly of getting hundreds of MPs from all over the country back at Westminster when they could be working from home? And if Mr. Sharma does test positive, might the Prime Minister have to self-isolate again?
Well, I've spoken to Alok within the last hour. He's doing fine. Actually, he's working today, but just working from home as usual. He's awaiting his test result. On Parliament, the important thing to say is, the important thing to know, actually, is that there are a whole series of pieces of legislation, including legislation directly to help fight coronavirus, and going back to the previous question of things that we need to be doing, which are passed through a process called secondary legislation. And those happen in smaller committees of MPs, and there are dozens of them, dozens and dozens of them. We simply haven't been able to, Parliament's not been able to pass that legislation, and that in turn puts the whole country at risk. So it is not some sort of, well, Parliament's come back just because it fancied it. It's come back because it needs to do things on behalf of the nation. However, Parliament also ensured that there was strict social distancing measures in place. So although we were involved in those votes earlier in the week, you were 2 metres apart at all times. And indeed, I know it's also the case that the Prime Minister's always been 2 metres apart from Alok Sharma as well. So obviously we wish him well. He's doing well at the moment, I happen to know, because I've spoken to him. He awaits his result, but because social distancing has been followed in in the proper way, I think with Parliament, it's absolutely right that it is able to sit and do its job on behalf of the nation, and that's what MPs themselves have voted for. Can I turn to Sharon Barber of BBC Look North?
Hello. The government maintains that from the outset that you threw a ring of steel around care homes and loved ones could no longer visit, but they were then pressured into taking in hospital patients that hadn't been tested. And now in County Durham, we have the highest number of care home deaths in all of England and Wales. And across our region, the North East and Cumbria, there are more than 1,300 care home residents who have lost their lives. Who's responsible for these deaths?
Clearly, first of all, it's absolutely heartbreaking. I mean, I think we probably all know people now who've been affected. The care homes are an interesting situation because, for example, people won't have been aware, the care homes procured their own PPE, for example, up until this disaster. Most care homes are privately owned, they're buying their own PPE. The government stepped in and has delivered millions upon millions of pieces of PPE to care homes in order to plug that gap. And it is, of course, I mean, heartbreaking that anybody has passed away in a care home from coronavirus at all. We do know that this is the same issue that everybody has been tackling, and that our rate of care home infection in terms of the overall number of deaths in care homes and the overall number of care homes affected in this country has been lower than elsewhere, which does not, of course, change the fact that things like clinical decisions made at certain times about who should leave hospital will have been an issue for the medical experts at the time. But if you look at the changes that were made in, for example, the guidance, they were made very early on, whilst, of course, everybody was still learning how this disease was spreading and operated. And you know, as I often say, you know, if we knew, you know, what we know now and had all the capacity that we had now, that would have been fantastic. But I think the care homes have been incredible in their response, and of course there'll be time to look back at everything once we've actually got through coronavirus itself. Sharon, thank you very much indeed. Can I turn to Dominic Yeatman of Metro? Dominic.
Hello there, thank you. Can you tell me, have you secured agreement with Scotland about the use of masks on trains and public transport, or will passengers be expected to put them on as they cross the border? And secondly, if I may, given that most holiday makers will have to quarantine for 2 weeks on their return, shouldn't the government be actively encouraging us to holiday in the UK?
Thank you. Well, yeah, on face coverings, as I mentioned in my comments, Dominic, it's an England measure. We're speaking to the devolved administrations, and they can decide whether they feel it's the right time for them to do the same thing. They may well decide to do that, but it is their call. You raise, of course, the interesting point of what happens on those trains which cross borders, and the answer is it would be that you would need to be wearing it in England. That's absolutely true. And it will be up to Scotland, or where trains cross, to Wales to provide their own guidance. Usually what happens, I can say, having been through this process in quite a lot of different ways over quite a long period of time with this coronavirus, is you end up finding that actually after some discussion, typically the nations decide to move together at roughly the same time on these things, or at least a few days apart. So I don't think it will turn out to be terribly confusing, but we have a devolved setup in this country with 4 nations who quite rightly can follow their own rules, and that's the way things therefore operate. I don't know if there's anything useful you can offer to this, Peter, because Peter says the chair of Network Rail, so then there's a national aspect to this.
So, I mean, our discussions with both the staff and our expectations of passengers probably don't vary. We should, of course, respect the sovereignty of the different nations, but I would expect people who board a train in England to be wearing a mask when they go in the station and on the train. And I would expect the passengers to be wearing it when they got off, wherever they were. And that would be just sensible, and it would be protective of both them and other people, and courteous too.
Did you want to come back on that, Dominic?
I was just going to ask you about holidaying in the UK, given that holiday makers heading abroad are going to have to quarantine for 14 days.
Yeah. So look, I mean, clearly this year, because the rules are at the moment, you can't stay somewhere else overnight. We now know we can travel as far as we want to, and you can even go and visit people in limited numbers, groups no more than 6, but you still have to return home at night. So that's obviously a limitation at the moment for national holidays, but we'll have to see how the course of the virus continues before we're able to answer that. And we also know, simultaneously, that the current Foreign Office advice is you can't travel unless it's absolutely essential. So we know that that's also in place at the moment. So sort of sadly, to answer your question, at the moment, we have to wait to see how the disease, the path of this continues to go. And people have this in no small way in their own hands. Measures like wearing face coverings will assist in a small way to fighting the R rate and help us get out of this and make holidays more of a possibility. But look, I think it's always a fantastic idea to be able to spend time in the UK. I'm also aware lots of people would like to go away. I'd love to be able to give you the definitive answer, but for that, we need to see exactly how the disease tracks and how we get the infection rate down over a period of time. Dominic, thanks very much. I'm just going to turn to Darren Slade, Bournemouth Daily Echo. Darren.
Thank you. After the chaotic scenes on crowded beaches like Durdle Door last weekend, what message would you give to people thinking of visiting the coast this weekend and to the local authorities who are concerned about the risks to public health? And meanwhile, we have many hospitality businesses who are worried about whether they can survive this year. And is there any industry-specific aid that the government can give in tourist towns like Bournemouth and Weymouth in order to help them get back on their feet?
Yeah, I mean, your question literally reveals two sides of the same coin in a way, because on one hand, people need to avoid very crowded areas, and to answer your question on crowded beaches, when we say stay alert, as it says on here, we literally mean keep 2 meters away from people. Don't endanger yourself and risk it and risk this spreading, and for us all to throw away the hard work that we've done. So the message could not be clearer. I suspect we might be helped by the slightly cooler weather this weekend, but nonetheless, the message remains the same. There's a further point I should also highlight, Darren, which is with regard to lifeguards. They've not been able to train, of course, during this period. There are fewer lifeguards around. That means if you are at the coast and you're in the sea, then you're putting yourself at more risk as well if you go swimming in the sea. So there are lots of good, sensible reasons not to go and crowd out beaches and avoid very crowded places. And to the second half, or the other side of the coin question that you ask on hospitality, I mean, as you know, there's been an enormous programme, world-leading programme. I think 819,000 firms have benefited from over £10 billion business grants and small business grant fund, and of course the retail hospitality and leisure grant fund. So there's been a lot of money paid to try to ensure in areas like Bournemouth and elsewhere that those companies can carry on going. We still have things like the furlough scheme, and as we come out of this, attached to the question before, which I'm afraid is of course the question when, and I can't answer that exactly when will people be able to travel for tourism, and we can't answer that until we know the path of the virus. But we have stood behind companies and places like towns like Bournemouth. We'll intend to carry on doing so. But the best way we can all do that is to defeat the virus by following the rules. So your question is very wise because it touches both sides of the same problem that we're trying to resolve. Darren, thanks very much. Can I go to Paul Geeta, East Anglia Daily Times?
Good afternoon. Thank you for inviting me, Secretary of State. Can I follow on from Sharon's question earlier? Suffolk has seen a greater death toll in care homes than many neighbouring and larger counties. We've had 152 deaths, and 70% of care homes in Ipswich and Mid-Suffolk have suffered a COVID outbreak. Why were hospital patients discharged into care homes only being tested from mid-April? Why has the guidance only recently changed to mean patients are no longer being sent to homes before receiving their test results? And why won't the NHS release a trust level breakdown of patients discharged to homes without tests?
Thank you very much, Paul. Look, there's been a lot of things said about care homes, but actually, when you look back at the history of when rules were changed or when the guidance was changed, a lot of these changes took place quite early on, and there have been a lot of steps taken. For example, the £600 million package to assist care homes. I think that's on top of £3.6 billion that's gone to local authorities, some of which is also intended for social care. And as I said in response to Sharon, of course, it is quite right that we will always want to go back and sort of track this backwards and see what were the medical decisions that were taken when and why. But to put this into a sort of a context, I know that it's the case that the majority of care homes, although not, as you just pointed out in the example you just gave, but nationwide, do not have any cases of COVID at all. But I think, of course, it's of particular interest why it is that in some areas, and I think you mentioned a figure of 60 or 70%, why it is in some areas those numbers have come up differently. So, of course, there will be questions to be looked at and reviewed. I noticed that overall, what's happened is because we've managed to build hospital capacity, and of course we had the Nightingale hospitals and those things, because we managed to build hospital capacity, we didn't end up in this country, as we saw and feared elsewhere, of other places where hospital beds and the ability to have ventilators and the rest of it were running out, which is a very good thing. And that has been part of what's helped us have a much lower level of overall death coming from care homes than in Europe, for example, as the average. But these are definitely perfectly legitimate questions, particularly the regional variation on those. And I know that my colleagues in Health and Elsewhere will be wanting to get to the bottom of all of those questions and why there should be regional variations in them as well. Can we turn to Paul Faulkner of the Lancashire Evening Post, please?
Thank you. Good afternoon. Your colleague, the Health Secretary, said last week that council public health bosses would have a crucial role to play in deciding whether to impose any local lockdown restrictions should they ever become necessary. That was actually on the same day that Lancashire's Director of Public Health advised schools in the county that he didn't feel that it was yet safe for them to reopen, contrary, of course, to the government's own advice at that point. Doesn't that show that it would actually make more sense to officially empower these local experts to make their own decisions about the easing of lockdown in the first place, in the hope that they can locally then avoid a second spike in cases and the very need to reimpose restrictions further down the line? And just in the absence of a scientist on the panel today, but this second question does cut across your own transport brief. Do you expect tourist destinations such as Blackpool to face a particular challenge in keeping the virus in check as and when lockdown measures are further lifted? And is the government planning any targeted help for tourist hotspots to assist them in their recovery?
Well, look, first of all, on local decision making, I think there's clearly a decision that needs to be always kept in mind between the extent to which you say things are for local decisions and the extent to which you have a clear national message that says, this is the date when X or Y is going to happen. In the end, when I talk to the scientists, which I've done on this case actually, and understood, is it the case that in one particular location schools aren't ready to go back, whereas in another location they are? The difficulty is having sufficient test data to understand in one particular location whether that's a justifiable decision or not. So I think to answer your question, in the end, you do have to have a national picture of it and make those decisions on a nation level, as we've done in the 4 nations. It is, of course, also true and perfectly proper that people may say, we think we've got a particular issue here and we'll delay by a week, which I think is the case that you refer to. That's also perfectly understandable. But I think on balance, you've got to have a national message. Otherwise, people watching this and doing everything else will be confused why, non-essential shops in other cases to take the unlocking on the 15th, if conditions allow, would be odd if that was taking place in one town but not in another in the very short term. And then on your final point about Blackpool, tourist destination, other tourist destinations across the country, as I mentioned in my response to Darren Slade at Bournemouth, we have been extremely concerned about all the organisations, businesses at the forefront of tackling COVID-19. It's been an absolute wretched time for everybody, but none more so than those in the hospitality sector. And that's why the kind of levels of support running into tens of billions of pounds now that I was outlining before have been so extreme to try to support them. In order to fully answer your question, we have to know what the path of this virus is going forward, because that's the only way we'll know the extent and when people will be able to move around more freely and perhaps even stay overnight and therefore open up the British hospitality sector. And I have to return to the point that everybody needs to play their part. And I think there's a danger, particularly as we go through these unlock phases, that people kind of start to think, well, that's all right, we're now able to do this, this and this, and sort of forget, and it becomes sort of a bad nightmare from the spring. It's not. It's still very much with us, and we absolutely have to focus on beating it. The government will always try to do whatever it can to stand by all organisations and hospitality businesses in particular, but we need people's help. We need people's help in order to defeat this thing once and for all, which remains as much as a big national effort now as it did when we very first started. Thank you very much, Paul. Thank you to everyone, and thank you very much to Peter. That concludes today's press conference.